Welcome to this video demonstration of how to perform the Timed Up and Go screening for patients at risk for falling. There are numerous Timed Up and Go or TUG screenings available. This specific method is based on the version provided by the American Physical Therapy Association's Balance and Fall Awareness Event Instruction Booklet for physical therapists. The written Timed Up and Go instructions are provided in the Fall Prevention Best Practice Intervention package in the Leadership, Nursing, and Therapy tracks. This package is available on the Home Health Quality Improvement National Campaign website, www.homehealthquality.org. This demonstration is being presented by Mary Callis, a physical therapist who serves as a coordinator from North Kansas City Hospital, North Kansas City, Missouri, and a consultant to Missouri Alliance for Home Care. Missouri Alliance developed and continues a home care fall reduction initiative, which is a national program to reduce falls using tools that have been tested and recommended intervention strategies. One recommended tool is Timed Up and Go. We'll now turn the presentation over to Mary.
We're going to talk about the Timed Up and Go test today. It's a tool to measure fall risk. And we have recommended it as a screening tool because it's very easy to set up in the home. It doesn't take a lot of room and it doesn't take a lot of equipment. And it can be conducted in most homes that you'll enter. It can be performed as a screening tool by both nurses and therapists. Sometimes therapists will use this tool not only as a screening tool but as to do further assessment and sometimes actual intervention. But for our purposes today, we're going to teach it to you as a screening tool. It's important that before you conduct this test with the patient that you ask them if they normally wear glasses or if they need their glasses to ambulate safely. Also, if they normally use an assistive device, you would want them to use that with this test. You might also ask them if they experience dizziness when they rise from a chair, and by the point that you would be conducting this test, you would probably have already taken their blood pressure and perhaps assessed for orthostatic hypotension, so you might have some clue about this at this point. And the steps of the test are that you would have them start by sitting in a comfortable chair. You would ask them, when you give the instruction, ready, set, go, to rise from the chair. If they happen to experience dizziness, you would instruct them to pause for a minute until that resolves. Then they will ambulate straight ahead 10 feet, turn around, come back down, and sit down. You will be timing this test. The time that is important because there are normative values for the test, and the scoring of the test is that if they conduct this task, the complete task, in 10 seconds or less, that they're considered to have high mobility. If it is 10 to 19 seconds, they're considered to have typical mobility. 20 to 29 seconds, slower mobility, and 30 plus seconds is considered to be diminished mobility. Now, those are kind of vague terms. What the other component that's important in this test besides how many seconds it takes is your own clinical judgment. So as the clinician, you're going to be looking to see, are they unduly slow? Do they seem fearful? Are they hesitant to do the task? Do you see any abnormal gait pattern, any abnormal movements of the trunk or the arms? Do they stagger or stumble? And did you note that they were dizzy at any point during the test? The Time to Get Up and Go test spans 10 feet. And often in your nursing bag or your physical therapy bag, you might not have a measuring device to measure off 10 feet in a patient's home. So what we're going to do is measure how far your normal gait pattern, how many steps you need to take to mark off 10 feet. And what I've done to do that is I've marked off 10 feet on the floor using masking tape. And I want you to start at this end and taking your normal size steps, walk to the other end and tell me how many steps you've taken.
Okay. 6.
So if you wanted to set up the Time Get Up and Go test in a patient's home, you would mark off 6 steps.
Oh, okay.
Okay. Rebecca, what I'm going to demonstrate for you now is how to conduct the Timed Up and Go test. You'll have your patient start by sitting in a chair. It is all right if the chair has arms on it. If they prefer not to use that type of chair, that is fine also. And the instructions that you will give them are, when I say ready, set, go, you will rise from the chair, walk 10 feet, turn around, come back, and sit down. Your job as the nurse conducting the test is to run the stopwatch. So when you say ready, set, go, when they rise from the chair, you will start the stopwatch, and when they turn around and come back down, you will stop when they sit down.
Okay.
So for example, ready, set, go, the stopwatch goes on, they walk 10 feet, turn around, come back, sit down, the stopwatch goes off.
Okay.
So now you can try it.
Okay.
When I say ready, set, go, you will start. Ready, set, go. That was a score of 7 seconds. What we're going to do now is conduct a timed up and go test so that I can better assess your balance. It's a really easy test to do. The instructions I'm going to give you are ready, set, go. When I do that, I'm going to have you rise from the chair, walk 10 feet to the space that we've already marked, turn around, come back, and sit down. And I'm going to be timing that test while you do it. Do you normally wear glasses?
No.
Okay. And do you normally use a walker
No.
or a cane?
Not today.
Okay. Have you been dizzy today at all?
Slightly.
Okay. I'll probably walk by your side as you do this just to make sure that you don't stumble. Are you ready?
Yes.
Okay. Oh, let's start again. Go ahead and sit down and wait for the instruction. Ready, set, go. That was great. That was a score of 23 seconds. As you can see, fall prevention involves more than screening and assessment. Other items to include that would be important are appropriate referrals to nursing and therapies, medication management, the removal of hazards in the home when they're present, and patient caregiver education. It really takes a multidisciplinary effort to make a difference in fall prevention.
We would like to thank Missouri Alliance for Home Care and Mary Callis for the opportunity to record this demonstration of timed up and go screening. For more information related to fall prevention, refer to the Best Practice Intervention Package and the Missouri Alliance for Home Care website listed on the slide. Together, we can achieve the vision of the right care for every person, every time.